So good afternoon, everyone. Thank you for joining our last session. I know people are just joining us as we just opened up this session. So we'll just maybe wait for 1 minute to get people logged on. As I can see, people are joining right now. Just as a reminder, we do have our chat box and our Q&A box for people who make comments or have this question for our speakers. You can post those as we go through and make sure that we don't miss some of your questions at the end of this session today. We're also at the end of the presentation for this for the session on cultural sensitivity and inclusivity. We will have our closing remarks as well. So these are a combined kind of session for the end of the end of the conference today. So without further ado, I know there's lots of information to be presented today, so I'm going to start the session. So welcome everyone to the Cultural Sensitivity and Inclusivity, Building Safe, Welcoming, and Equitable Spaces session today. I would like to introduce our speakers that we have that are joining us. We have Dr. Rose Joudi, and she brings over 15 years of expertise as an aging and ethnic diversity consultant. She is currently the research lead on an ethnocultural elder abuse awareness project for CARYA in Alberta. Rose contributes valuable insights to the field through her background in academia and research. Dr. Joudi collaborates with stakeholders, addresses the unique needs of older adult diverse populations. She's committed to ensuring or enhancing seniors' quality of life. She actively promotes educational strategies and facilitates training sessions, including elder abuse awareness, ageism, trauma-informed care, and cultural competence and compassion when working with diverse populations. Dr. Joudi is also a board member of the Canadian Network for the Prevention of Elder Abuse and serves as an advisor for the Ministry of Seniors, Community and Social Services in Alberta, Canada. So welcome, Dr. Rose Joudi. And with her is also Dr. Brittany Jakubiec, and I think I'm going to get your name wrong, Brittany, so I do apologize. She's a French-Polish settler living and working in PEI. They are the Director of Research at EGALE and have been in this role since 2021. Brittany has more than a decade of experience in qualitative and mixed methods research, as well as multi-sectoral work experience in nonprofit, leadership, academia, and teaching, as well as government. And in their spare time, when they have that, they enjoy cooking, reading, and playing games and spending time with their family, which is so important. So I'm going to first turn it over to Rose to start the presentation.
Thank you. Thank you so much for the introduction, and thank you for inviting me here. I am very excited to be part of the conversation, and I've been listening to all of the wonderful conversations and presentations that have been happening. And it's very exciting to see what everyone is doing. The segment that I wanted to share with you, and I know that a lot of the conversations that we have heard today have dabbled and talked about it in some way, in some form, but it's something that I'm actively advocating for and working on here in Calgary. And I wanted just to share some insights about some of the I guess, information and findings that are coming out of the work that we're doing at CARYA when it comes to elder abuse and being culturally compassionate and sensitive. So before I start, I just wanted to kind of highlight that within ethnocultural communities, in particular, those that are linguistically and culturally, spiritually and religiously different from mainstream society, it seems that there is still this stigma of reporting elder abuse, domestic violence, and this stigma around reporting it is one of the reasons why we don't really have statistics that clarify, number-wise or quantitatively, the extreme need of support for ethnocultural communities when it comes to creating supports that are culturally compassionate and compatible to their needs. The other thing that I also wanted to highlight is in ethnocultural communities in general, shelters and social service groups and providers are not a norm in these cultures or communities. And as a result, when we don't see ethnocultural groups or members accessing these supports or resources, it's not because they don't need them, it's because it is not a familiar resource that they may have been privy to in their own communities or back home. So there is this cultural perception in some ethnic groups that sticking around and remaining in an unhealthy relationship is actually for the good and benefit of the family, in addition to the fact that the shame and stigma associated with this experience is one of the reasons, or actually two of the reasons why some ethnocultural groups don't necessarily feel comfortable in accessing some of these resources. And so in the conversation today, I just wanted to kind of highlight initially where the conversation is going, and my focus will be on ethnically diverse older adults or communities in general. I did want to, of course, do a plug for CARYA, which is the organization that I'm working for, and also the organization that I'm doing the Ethnocultural Elder Abuse Project for as well. So CARYA is a social impact agency. It's more than a century-old. So it was established in 1910 here in Calgary, and then it evolved to become this organization that has three branches or three offices in Calgary, in the Northwest, in the Southeast, and also in Central Calgary. The programs that CARYA offers are programs open to family, children, parents, and older adults. And we do have an elder abuse responsive team that is associated also with the Calgary Police in the organization. So the programs that it offers vary from financial wellness to family functioning to mental health and well-being, in addition to supports for older adults that actually includes counseling, as I mentioned, an elder abuse response team, an older adult crisis outreach team, and as well as a division called The Way In, which is connecting older adults to community services and supports. So before I start, it will be important for me to highlight that ethnocultural older adults, which is a term that you'll be hearing me use throughout, refers to older adults who have an ethnicity or religion, race or culture and language that differs from mainstream Canadians. This also includes those who had immigrated to Canada at a young age, in addition to those who entered the country at an older age, and usually it's through a family reunification. And so it's a really important thing to keep in mind. And the reason behind that is you will have two immigrant groups who are aging in the country, those who arrived here at a young age or who are even born here, and those who had arrived at an older age, and their needs are actually different. They should not be lumped together or assumed that they need the same resources, because their challenges will be considerably different as a result of that, the age of them entering the country. So the reason behind having this conversation, I think, is super important because there is this understanding and appreciation that we are seeing a larger ethnically diverse older adult population that are aging here in the country, and their needs will be different, their expectations are different, and also their backgrounds, their contexts, and the experiences that they've had throughout their life journey are unique to them. And as a result, it is very important to have those in mind at times when we are working with them and trying to find out the right resources for them. So it goes without saying that it is important for us to be culturally sensitive to older adults who come from various ethno-linguistically and cultural backgrounds. However, I do want to also reiterate the fact that just because we don't speak the language of our clients or of the older adults that we serve doesn't mean that we are not able to build a relationship or build rapport and trust with them. I do strongly believe in the fact that cultural empathy and compassion and humility, all of those things actually can bypass at times language. And as I heard from various speakers today, sometimes you just use sign language or images, visual cards or any visual image that you have, and your message will be heard in that sense if you don't have interpreters or translators in the meantime. And the reason why it's important to have that understanding is there is this need to be respectful of the diverse identities. And again, we heard in the conversations today about the intersectionality of identities of older adults, and that is something that is very important for us to keep in mind. And your older adults that come from ethnocultural diverse backgrounds, as I mentioned initially at the start of this conversation, they may not be coming from a society or a background in which accessing social services and resources are a norm. And as a result, when they don't know about what you have to offer, then they will not access what you do have to offer. And I'm a huge advocate for being, quite intentional in community outreach, and in particular with ethnocultural communities and communities in rural parts of the province as well. And also, when you do provide a resource that seems to be culturally compatible or competent or respectful of all older adults, regardless of their backgrounds, regardless of their race, their gender, their identification, then you are creating an environment that could potentially be one that they will feel safe and comfortable to access. It's easy for us to say that we have the resources and support, but if these resources and support do not speak their cultural language, and I don't necessarily mean literal cultural language, but if it doesn't seem to respect diverse older adults or the fact that there are diverse older adults in the community, then they might not feel comfortable accessing them as a result. And, thinking to the pillars of trauma-informed care, trustworthiness and safety are two of the main pillars of trauma-informed care. So if you have that trauma-informed lens as part of your organizational process, then you know that earning that trust and building that sense of safety is something that you are given by your client as opposed to expecting it and assuming it. And as a result, you create opportunities for them to be empowered, for them to feel independent, to be in the driver's seat and in charge. And again, we heard that today, that it's important to give that agency and control in the hands of our clients. It's not about what we think they need from us, it's about what they need from us, in addition to when they need it is based on when they feel that it's the right time for them. And also it creates opportunities for holistic healing. And this includes addressing the needs of your clients from not just a physical or psychological and emotional component, but also spiritual and religious as well, in addition to, of course, preventing that re-traumatization. Keeping in mind that some of these shelters or these spaces might not physically look safe or look comforting or look like they are culturally compatible with the needs of our clients. They might look like places in which They may have been incarcerated before, or they may have been accessing or forcefully accessing before fleeing their own country. So it's important to keep in mind, what are the colors of the walls? Do they have big windows? Are the doors, you know, do they seem like they can be locked, but not locked where they seem that they can't access or exit it? And so it's things like that that sometimes we have to keep in mind, how we are structuring or how these houses look, even physically from the outside, might be things to consider when we are creating these safe spaces for our clients. And that way we are trying to, of course, honor their cultural backgrounds and their diverse needs. When you adopt that approach of trying to understand the cultural needs of your clients, and I understand that the resources are scarce and the funding is limited, and your manpower is also sometimes stretched beyond you know, realistic abilities, I would still urge you to pause a bit and think about sometimes really taking your time in establishing and building that rapport and that relationship with your clients. Looking at ethnocultural older adults from a strength-based lens is very important, and it will be a valuable part of your engagement with ethnocultural communities. Remember, some of these ethnic communities come from backgrounds in which they distrust authority, and that includes anyone that comes from a background in which there is a power dynamic shift. So even if you are a not-for-profit or a social service agency, you still are looked at as someone who has far more power potentially and or authority than your client. And in itself, that could cause the client or the older adult to not feel that they can trust you or open up to you. And I know that it's been mentioned in the conversations today, the way that we're dressing, for example. Sometimes I do take my lanyard off, I do dress down, I do have tattoos, and so sometimes I do wear sleeves to cover my tattoos. And this is all to ensure that I am presenting myself in ways in which the person in front of me or the community in front of me feel comfortable, because it's about them, it's not about me at the end of the day. And so when you look at your clients from that culturally competent and compassionate lens, but a strength-based lens, you will realize the potential. Older adults who are especially immigrants or refugees who have fled traumatic life experiences and potentially are experiencing still trauma in Canada, they do come and do have a heap load of mechanisms that they could use that are hopefully effective ones for coping in the past, and having conversations about those mechanisms and skills in the current time might be very beneficial for them as well, to highlight that the tools that you used in the past could potentially be adapted and used in the current time, and think about what it is that they want from you and how you can support that based on their cultural backgrounds and identity. And so, again, we've had this kind of conversation really before, but I just really wanted to highlight that ethnocultural older adults who immigrated to Canada willingly or not as refugees, they are a heterogeneous group of people. They are not alike. Even in the same cultural group, there are differences. Even within the same ethnic communities, there are differences, and they should be respected as a result of that diversity as well. So the cultural identities that they come with don't really put them in just a lump of that particular cultural group. So when you look at trying to understand your clients who are ethnocultural, understanding that there are various cultural barriers, even if they come from the same country, there could be different ethnicities and races within that country, in addition to language barriers. And again, people from ethnocultural backgrounds from the same country could actually speak multiple languages, not necessarily just one. There are also literacy and educational backgrounds that are different. And again, we heard this in the conversations today. There's this understanding that refugees or immigrants could potentially benefit from translated or interpreted documentations. But what I found through my work is I'm actually working with a lot of low literacy ethnocultural communities, which sometimes means that they are illiterate in their own language. So they do not write it or read it. And as a result, having translated or interpreted documents doesn't actually help them at all. But what you can probably provide is verbal files, perhaps, or a verbal way of communicating or giving them that information. There are huge financial barriers, of course, and that they are diverse among the needs of your older adults. Immigrants might potentially be more, socioeconomically prepared, as opposed to refugees who are fleeing hardship and war, and as a result might not come with the same financial abilities. And also, because of the new laws that we have, or the new law that we have here in Canada, an older adult who is sponsored by a family member, usually an adult child, that sponsor or that adult child has to meet the basic and financial needs of that older adult for 20 years, which means that we are also working with older adults who cannot, for 20 years, access any financial service or ability in the country, which includes, of course, old age pension. Now, some provinces do have some of these services, or they do assist older adults who, even though they're sponsored in some financial service or way, but we all know that it doesn't necessarily meet the financial needs in terms of being able to find an accommodation and pay the bills, etc., especially if these older adults in the past didn't have the opportunity or the independence to be able to know how to navigate some of these complex systems. Other barriers that your older adult, your ethnocultural older adult client might come with or experience include, of course, their health, which includes their physical health, in addition to their mental health. And just like elder abuse is also is a stigmatized topic to talk to ethnocultural communities about, mental health and mental well-being or mental illnesses are also stigmatized topics to discuss with some ethnocultural communities. And so we might have a lot of older adults who come with undiagnosed mental illnesses, and that could be an additional challenge as they are also trying to access resources and supports for their safety. The traumas that your client has experienced is also an additional challenge for them. And this doesn't just include the traumas that they experience back home, because traumas can be ongoing. So it includes trauma back home, trauma as a result of the process of coming to Canada, in addition to the trauma that has or is experienced in Canada or in the country as well. Because of I guess the time, I'm trying to be very mindful, and so I'm not going to kind of talk about the intersectionalities. I think it has been covered enough, but I do also like to let you know that I will be providing my slides as well if you would like to have a read of it. But I just wanted to kind of highlight in this slide that it is very important to, of course, acknowledge how there is that intersectionality with ethnic identities, with the experiences of the clients, with also the stigma associated with even talking about and reporting the abuse that could be occurring, and whether or not there is going to be that shame associated with it, which is why we see underreporting in ethnocultural communities, or the fact that they don't know of the resources out there, or they feel that they're not culturally compatible to their needs. And so, as I mentioned, the sensitivity is is important to kind of keep in mind, being culturally competent and having inclusive spaces. This includes understanding that ethnocultural diverse people, if they do seek support, they are more likely to actually seek informal support. And so some of the older adults that I've been talking with in the elder abuse project that I'm doing here in Calgary are more likely, in their words, to talk with their family members, which includes extended relatives and family, about the abuse or the mistreatment or the situation that is uncomfortable or negative. And if they don't find comfort within that conversation, then they will talk to their ethnic leader or spiritual or religious leader. And at times, that's where the conversation may stop, especially if you haven't built rapport and trust or trained ethnic leaders and spiritual leaders, which I think is something important also to keep in mind as you're building that bridge when you're doing community outreach. Identify who the leaders are of the community and invite them into your organizations to explain to them how you can benefit some of their members if they need the resources and support, also highlighting that you are inclusive of all older adults or all people within that community. So we find through research that ethnocultural older adults are more likely to seek informal support first, rather than actually accessing the resources that are available in society. And these reasons for that initial informal reach out is that there is, again, stigma associated with speaking up about abuse, especially if it is an adult child or a partner. The belief that there is a lack of culturally compatible and competent resources, and I'm not just talking about translating it into their language, it is more than that. And the fact that there also could be a language barrier and lack of or shortage of translators. And then really sometimes when I talk with ethnocultural communities, there's a lot of questioning about what is out there. What is out there for us to help us out? And so what I'm finding is that ethnocultural communities do not know, do not have the knowledge of the resources that are available. And here, for example, in Calgary, a lot of our agencies are usually located in various parts of the city. But if your older adult cannot access public transport for various reasons, or does not know how to navigate public transport, let's say, they will not be able to access your resources. So I think it's very important to go to the community as opposed to assuming the community can come to us. And then another interesting reason behind not seeking formal support is a lot of older adults, and especially low literacy and lower educated older adults who do not speak English or who have not attended or have been prevented from attending English classes. They have a lot of misinformation. There's a lot, there could be a potential, a lot of inaccurate, incorrect information that is circulated within ethnic communities. And when they're not corrected or verified, then it's a lie that is a truth, as they say sometimes. And so some of them fear that if they were to speak up about being abused by their sponsor, that they will be deported. And it could be that it's the sponsor, him or herself or themselves, that have actually said that. And as a result, because your older adult doesn't speak the language, could be potentially socially isolated, they believe that as a truth. And so they don't necessarily speak up. In addition to, of course, losing access to children, grandchildren, or any form of financial support. So building these relationships with ethnocultural communities matter. Building rapport and trust matter. The wording that you use in your flyers, in your posters, in your programs matter. I don't speak about elder abuse when I go into ethnocultural communities, and some of you know that already. I go in telling them that I'm here to talk about healthy aging and promoting and enhancing healthy relationships as we grow older. And so I've learned that through experience, that the way that I use my words and how I reframe some of my programs or workshops that I do with ethnocultural communities either opens or closes doors. And as I mentioned, shelters are not a norm in some ethnically diverse societies. And so even thinking about accessing it is something that the person might feel uncomfortable with, because it's associated with the stigma, a weakness, the shame. What if my ethnic community hears about the fact that this is happening to me and this is where I've ended up? And there's some pride and ego in there too as well. I also would like to highlight that many of these older adults who come from collectivist cultures value family considerably, which means that when we are trying to help an older adult or a person, keeping them safe, helping them access resources, they might not want that resource and support if it doesn't involve their family, which includes the perpetrator, by the way. And so I've spoken to some older adults who would say, don't give me the help and support, give it to my son or my daughter, because when they're healed or supported, then they will stop abusing me. And so including the family, which also includes the informal resources or support, which is the ethnic community, is a very essential step. Ethnocultural older adults do not want to be plucked out of their ethnic community in most cases and are ostracized or isolated from them. And then, of course, using a strength-based approach in your language, in your understanding, and thinking about what these strengths and capabilities look like. I can see Rayanne showing up. Is that a sign that my time is up?
Yes, unfortunately. I do want to give Brittany time to do their presentation. So and I know we have a lot of other important slides too. So, but maybe we'll get to that in the question answer. But if you don't mind, maybe we can just stop there and then have the next presentation. Thank you.
Thanks a lot.
Just a reminder, if anybody has any questions, please put those in the chat box or in the Q&A box, and we can do the session, a little bit of the Q&A at the end of the session if you have questions for Dr. Rose. Thank you. Go ahead. You can share your screen.
Okay. Just gonna swap.
Yeah, that's right. Perfect.
Awesome. All righty. So thank you so much, everyone, for a lovely day. I've been able to attend the sessions, and it was a really lovely learning opportunity for me. I'm primarily a researcher, so I'm more so kind of behind the scenes. So I appreciate everyone working on the front lines of these issues and supporting folks from across Canada. It's been really lovely to hear about your work. So I'm just going to quickly introduce myself for folks who don't know me. My name is Dr. Brittany Jakubiec. I use they, them pronouns, and I'm the Director of Research at EGALE Canada. I've also put my email on the slide if you want to reach out to me directly. So before I begin, I just want to share a little bit more about who is EGALE. So EGALE is Canada's leading organization for 2S LGBTQI people and issues. We improve and save lives through research, education, awareness, and by advocating for human rights and equality in Canada as well as around the world. Our work helps create societies and systems that reflect the universal truth that all persons are equal and none is other. And folks can check out our organization and learn more at egale.ca. So for today's presentation, I was thinking about the answer to the following question. What is needed to support needs of the diverse aging population in Canada? In this case, I'll be focusing on 2S LGBTQI older adults in Canada and presenting some of EGALE's projects and initiatives that are hopefully relevant and helpful for today's conversation and for the attendees here. I do recognize that my presentation shifts a little bit to be more resource and research focused than the previous presentations about how folks deliver services and meet the needs of older adults in Canada. I do hope it's helpful. So in this presentation, I'll be primarily focusing on a research study that we conducted called Aging and Living Well, and a research brief that we published called Elder Abuse and Financial Abuse. So I'm going to start first with the Aging and Living Well project. And this project explored two research questions, and they're on the screen. It's what does it mean to age and live well for LGBTQI older adults in Canada? So this would include lesbian, gay, bisexual, trans, queer, and intersex older adults in Canada. And the second research question that's explored in this presentation, but in this report as well, is what could aging and living well look like in Canada? And then just a reminder of where folks can read the final report. People can read it at egale.ca/aging and living well, or ALW. So I wanted to give a little bit of the background to the study so that folks can know the context. So the Aging and Living Well study was a national interview-based study, and it had 48 participants from across Canada. The study was led by Dr. Celeste Pang, who at the time was a senior researcher at EGALE, but is now an assistant professor at Mount Royal University. And the study explored the following questions. What does it mean to age and live well for LGBTQI older adults in Canada? What could this look like? And what social changes are needed to better enable LGBTQ older adults to live and age well on their terms? So in this research study, we asked participants about their living situations, their material concerns, such as housing and finances. We asked about their experiences accessing healthcare and other social services. We asked them about their thoughts on end of life and what well-being and aging looks like for them. Further, just to plug this resource, in the next few weeks, we'll be launching a free self-paced online training for social service providers to learn more about how they can support LGBTQI older adults in Canada. And this training is based on the Aging and Living Well study. If you want to stay up to date on that training, you can subscribe to the EGALE newsletter, which is, if you go to our website, it's at the bottom of the website. We'll be informing everybody in the newsletter of when that training is live. And because the Safe Haven conference today was about shelter options for older adults, I thought that it would be pertinent for me to focus solely on the housing findings from the Aging and Living Well study. So just a little bit on the literature about what is known about this topic. Housing and access to affordable housing and secure housing is a national issue that crosses generational and geographic boundaries, as many of the people on this call have even spoken about the housing crisis in their respective cities and provinces, including rising costs of homes, the rising costs of rent. And this, of course, affects people of all ages, but it in particular does affect older adults. According to Statistics Canada in 2022, there's been an increasing number of people living in unaffordable housing or who are in core need of housing. In this study, 17% of people over 65 were either living in unaffordable housing or were in core need of housing. In Canada, according to a study in 2021, LGBTQ plus households spent more of their total household income on shelter or housing than their non-LGBTQ counterparts. They were also more likely to be in core housing need. And in the research, there's been less attention paid to LGBTQ older adults and housing in Canada. Very few studies have focused on this population specifically in relation to housing. However, the Canadian Mortgage and Housing Corporation in 2018 identified both older adults as well as LGBTQ plus people as among those in greatest need of housing in Canada. So now on to the study itself. As I noted earlier, this was a national qualitative study with 48 older adults from across Canada. The interviews were conducted in 2021, so definitely at the height of at least the Omicron part of our pandemic. So these were done virtually with older adults. Participants were aged between 64 and 81, with the average age being 70. And participants came from 8 Canadian provinces and were from both urban and rural areas, but as you can see on the slide, slightly more from urban areas. In terms of participants' living arrangements, most participants did live either alone or with their spouse or partner. And there were a few participants who lived with others. This could include roommates. And in terms of housing types, participants primarily owned their housing, and second to that, participants were renting. And as I mentioned earlier, I'm only going to focus on the housing section of this really large and amazing report. But if people are interested, the report also covers a few other major areas associated with aging in place for older adults. The other areas covered in the report that I won't be touching today is employment, social connection and disconnection, healthcare access, and death and end-of-life well-being. So this slide will only speak about the housing findings, and I'll get right into it. So homeowners and renters among the participants expressed concerns about the rising housing costs and their financial ability to meet rent and other living expenses. Many participants described their finances as tight or limiting, and some described being what they called house rich and cash poor, meaning they had equity in their homes, but it was a challenge to meet their day-to-day needs. This could include groceries, their medical costs, etc. Because of this, being house rich and cash poor, some participants actually sold their homes and decided to rent instead. Another finding was around the increase in rental costs. Housing rental costs were so great for some participants that they needed to work to meet their basic needs. And this was particularly true for participants who did not have a private pension or were receiving a very low government pension. This finding reflected the dynamics of economic precarity and the required workforce participation. So despite many participants being in the age of retirement, many had to return to work or continue working post-retirement to meet their basic needs. There was also differences in housing security among people who were either living on a single income, usually by themselves, or in a partnership where there was only one single income, compared to those who were living with 2 or more incomes, such as if they're living with a partner or spouse and both individuals had an income. Those living with others or in a shared income situation were able to pool resources and have a safety net in place when it came to housing and expenses. Those who were living alone or were living with single incomes were not able to fully establish a safety net. Of course, this means when issues arise or financial struggles arise, there's just more tightness in those budgets and those finances. And in terms of being queer or trans or being out about their identities, participants expressed mixed experiences about being out where they were living, particularly if folks were living in an apartment building or a condominium building. Some people were able to be out safely, and some people were hiding that part of their identity. Some participants spoke about being able to foster strong social connections with their neighbors in those settings. Sadly, though, other people talked about experiencing discrimination and homophobia and transphobia in those settings. And in those cases, it could be from a neighbor, and in some instances, even a landlord. Finally, when participants were thinking about moving somewhere new, the topic of LGBTQI safety, belonging, and acceptance was certainly top of mind, and participants had concerns that if they moved, would they experience safety, belonging, and acceptance in the new place they were living. So I wanted to share the recommendations specific to the housing section of the study. In the report, each of the subsections has specific recommendations for policymakers, for practice, for organizing. So I'm just going to highlight the one specific to housing. If we think about policy recommendations around housing, there were 5 main recommendations made in the report. First, the recognition that housing is a basic human right, and there's a need to prioritize housing for people to live in. The second recommendation was to implement policy measures that restrict the purchase of housing as a form of investment, and we need to combat the financialization of real estate. The third recommendation was to implement rent controls, and the fourth being the need to create not-for-profit rental housing and expand units and eligibility for rent geared to income options. This was really important for older adults. As I mentioned earlier, folks having access, fewer income or lower incomes, more tight finances. And the fifth recommendation for housing policy is increased funding and eligibility for home modifications and retrofitting to increase accessibility, including ensuring 2S LGBTQI and diverse family and household units are being recognized. A really great example of a policy and program for eligibility for home modifications and retrofitting is the Aging in Place program in New Brunswick, which recently was awarded more funding. And this program was developed to keep older adults in their homes as they age. So there's lots of funding available for modifications and retrofitting. This is a great example for other jurisdictions to follow. There are 3 recommendations for practice. The first is implementing universal design principles in new housing designs, meaning thinking about accessibility when developing new housing options and thinking about accessibility from an aging perspective as well. The second recommendation is to rent to older people, rent to people with disabilities, and rent to 2S LGBTQI people. These are populations that face greater barriers to housing, so we need to specifically create housing options for these folks. The third recommendation for practice is to listen to 2S LGBTQI people's concerns when they share experiences or fear of discrimination and harassment in the places where they live, and if possible, implement measures that will address the roots of these problems, i.e., people 2S LGBTQI older adults are not the problem or the issue. The experience of discrimination and harassment by a landlord, let's say, is a problem that does need fixing. And finally, there were 2 recommendations for collective organizing. The first is around finding a common cause in housing issues. And what this means is that housing insecurity and access to housing affects everyone. We all need access to housing. It is a human right. And then recognizing how it does impact certain populations differently, including 2S LGBTQI older adults. It's important to find common cause and come together and advocate for measures and solutions that increase access to safe and affordable housing for all. And the second recommendation is to continue exploring alternative housing models. So there are lots of great models being developed and implemented across the country, and we need to keep finding new ways to solve this very complex problem. So the second half of this presentation is going to focus on a research brief on elder abuse and financial abuse. This brief looks at the challenges faced by 2S LGBTQI people and provides recommendations for service providers. And this brief covers 2 questions primarily, which are on the screen here. And they are, what challenges do you see for 2S LGBTQI communities? And how can service providers and policymakers provide greater supports? So a little bit of a background on this brief before I begin. It's entitled Elder Abuse and Financial Abuse, Context and Considerations for 2S LGBTQI Communities, and it was released in 2022 in collaboration with the Elder Abuse Prevention Ontario. You can find it on our website, and it came about, it's important to note that this brief came about in consultation with 2S LGBTQI older adults. There was also a project advisory committee as well as a guest expert. The brief responds to the question of, or informs people about what is elder abuse, what is financial elder abuse, and what does this look like among 2S LGBTQI people. It also highlights a lack of research and literature about elder abuse among 2S LGBTQI people. I believe there's almost nothing on this topic, though there is a few sources from outside of Canada. In this brief, there were 4 themes that were identified based on community conversation that was held. The 4 themes are trust, erasure, increasing community education and reducing isolation, and the 4th theme being recognize distinct and layered experiences. Within the theme of trust, people who took part in the conversation expressed a lack of trust in some institutions, including social services as well as police services. Participants in this conversation noted it can be difficult to find people that you trust, and in smaller communities, it can be even harder to identify people that you can trust. People in the conversation noted that reporting to police isn't always an option, and that this experience can be felt very differently, especially for Indigenous and racialized people. There is one suggestion made about having a queer community police liaison that would enable 2S LGBTQI older adults to reach out for help with more confidence, though this does have to be balanced against the lack of trust in this particular institution. Within the theme of erasure, it was noted that queer families and chosen families are not always recognized, and that there's a heightened need to do advanced care planning carefully. We also have an advanced care planning resource on our website. It's at the bottom of the brief that's been linked already. Further, domestic abuse is not always taken seriously in queer relationships when it's reported to police or otherwise. There's always some doubt, and it's just not taken seriously. Finally, it was noted as well in the conversation that blanket approaches to addressing solutions for quote unquote all seniors or solutions for seniors' issues does not always include the lived realities of 2S LGBTQI older adults. The third theme in this brief was about increasing community education and reducing isolation. Participants in the conversation noted there was need for more community education on what is elder abuse in 2S LGBTQI communities. And people asked for more measures to reduce isolation felt by older adults. In the COVID-19 pandemic in Canada, we saw an increase in intimate partner violence and unsafe home environments, particularly during the shelter-in-place moments. Elder abuse prevention and support services need to be well advertised across all communities. This is a way to increase education. And we need to ensure that the information is available in accessible formats, so in various languages, for example. And finally, the last theme for this brief was about recognizing the distinct and layered experiences of community members who do experience abuse and the different types of abuse that they experience. We need to name what people are dealing with and what specific communities are dealing with. For example, when folks are experiencing racism, homophobia, and transphobia, and the intersections of these things. We need to then take a layered approach to understanding oppression. For example, creating campaigns that target the prevention of financial elder abuse and making sure that these campaigns or education campaigns address the unique circumstances of newcomers, for example, or BIPOC older adults. Finally, this brief included recommendations for service providers, as well as policymakers. The first recommendation is for community-based services to be accessible and affirming to 2S LGBTQI adults. This means thinking about how your services might be meeting the needs of trans, non-binary older adults, as well as queer, lesbian, gay, bisexual older adults. How are you inviting them in and making sure their needs are being met? The second recommendation is around diversity, equity, and inclusion training. So DEI training should be provided to all staff that will be interacting with clients or folks accessing services so that they can recognize, understand, and address things like homophobia, transphobia, and racism. This is particularly helpful if you're working with an older adult who is 2S LGBTQI. And just to note, I didn't have time to discuss these things too deeply today, but this brief also includes information on barriers to reporting as well as red flags, being able to spot the signs of financial elder abuse, and they are on the same link as the brief that's been noted. In my last few minutes, I just wanted to take an opportunity to highlight a few other EGALE resources that I do think would be of interest to the conference attendees. Over the last few years, we've been increasingly creating resources and reports specific to 2S LGBTQI older adults, and I hope these can be of use in your work. So the first one that I want to highlight is the National Resource Center on 2S LGBTQI aging. This is a wonderful resource center that we created in collaboration with the National Institute on Aging. And it has lots of different moving parts. There's a resource page, which is compiled of community-based resources. There is a research page where you can find Canadian research specific to aging among this population. And there's also a map of organizations that provide services for 2S LGBTQI people in Canada. Further, if you have a resource that you would like to see added to this website, there is a contact us form, and you can submit the resource to us and we'll add it. The second EGALE resource that I want to highlight is the work that we do in the area of dementia. The resources in this area is under the title of 2S LGBTQI Dementia Networks of Care, comma, or hyphen, where do you fit? So this project is inviting people to see where you are in this network of care. And there's lots of great resources you can access. There's a final research report, which focuses on 2S LGBTQI people living with dementia, as well as their unpaid carers. There's also an online self-paced e-modules for carers and healthcare and social services professionals. And the characters that you see on your screen are a part of this training. We used character case studies. And there's many other resources on that website for anyone who's working frontline, either in social services or in healthcare. The third resource I wanted to highlight was the Fostering Dialogues project. This project was an arts-based action research project that brought together LGBTQ older adults and personal support workers in Ontario. And in that project, we explored themes of home care and the futures of home care. You can learn more about the project using the link that's been put into the chat. And really importantly, on this website, you can find the final report, which summarizes our research findings. But you can also view this beautiful mural that you see on your screen. And on the website, you can actually click different parts of the mural to find out more about the person's thoughts behind their artwork. And you can read a little artist statement and find out more about it. I would also be remiss if I did not give a shout out to the artist behind this project who worked with our participants to create what you're now seeing. Her name is Melanie Schambach, and she's a really, really lovely social artist who does lots of great work across the globe. Finally, the last resource I would love to highlight for you folks today is an awareness campaign that EGALE launched earlier this year. It's called Help Us Remain, and you can learn more at the link there. And it's about bringing care for identity to the care for dementia. This project looks at how people living with dementia are treated within the healthcare system specifically, and it does build on the research we had done with people living with dementia and their carers. You can learn more about the campaign, and on the website, you can watch the short film that was created for this campaign. And there's also a series of audio stories of 2S LGBTQI older adults living with dementia. And you can check out and listen to those audio stories, and the website links additional resources as well. So thank you all so much for your time and your attention. I would happily connect with anyone after this conference. The general inbox email is listed on the screen. Yeah, thank you so much for your time.
Thank you so much, Brittany. That was excellent overview, and especially the housing piece that you talked about. I knew a little bit about the financial project that you did because I was involved in working with that, and I think you were involved, I think, somewhere along the line as well, and as well as that last campaign that you just talked about. So thank you. Rose, do you want to come back online? If anybody has any questions, I know we're a little bit over time, and we so appreciate your patience with us, but didn't want to cut anybody off because there's such great presentation information for both of you. And I know that we'll have to invite you back again to go further deep into both of your presentations, because you had such a wealth of knowledge that you were sharing with us. And I think there's such applicability, especially, you know, I know Brittany, you indicated the research piece, but they go hand in hand, because we learn from the research to do the application in the community, and vice versa. So it's bridging the two is so important, and you can't do one without the other, I don't think. And I just think even the cultural sensitivity, inclusivity that Rose, that you were mentioning, it's so many things we take for granted, I think, in terms of the different, you mentioned about the different, there's so many differences within cultures, and we kind of stereotype, well, you're from this community, so they're all the same. And yet there's such, diversity within that group. So, and similar to the 2S LGBT communities, like we can't just assume everyone is all the same. So I appreciate all the insights, and there's so much to absorb. So thank you for sharing your slide decks for sure, because I know many people will get much more out of that. And I know, Rose, you didn't finish all of them. And, but at the same time, the depth of the knowledge that you shared was so good. Now I'm not sure if there's any questions that are coming in. Or
So I'm monitoring
thank
the
yous?
Q&A so far. Just thank yous. I think, it's the end of the day. We're getting into a bit of a lower energy mode for everyone. It's completely understandable. We're going to keep this open, I would say, for a couple more minutes, just in case people are typing their question right now. While we wait, I just wanted to reiterate, as Brittany was speaking, I was copy and pasting the links to these different resources in the chat box. So if some of you were completely engrossed in the presentation and didn't notice, you can go now, you can click on it directly, of course, and see it now and, save the link, everything. But don't worry, we're going to be sending the full list of all the resources and all the places that you heard about today in one document so that you can access it easily as soon as the recordings are processed. So one way or another, you will get all this information, this beautiful information. Particularly, I would say if you want to watch something short today at the end of this session, the video for the Help Us Remain campaign is beautiful. I watched it a while ago and I absolutely loved it. So that's a good one to end the day on. I don't see any questions coming in. I feel like maybe that's going to be a bit of a delayed thing. You might receive questions. We'll forward the questions to you if they come through a little bit later. And then, yeah, we might have to explore future webinars with each of you independently, so you have ample time to explore everything. I think that might be it for it. Thank you so much, Brittany. Thank you, Rose, for coming, for speaking so eloquently about this. And while we're at it, thank you to all the other presenters today who made time to be here, and for all of you who listened. Kick around for a few more minutes. We have Margaret McPherson coming back for a few last words. She's been, I think, taking it all in, and she's going to impart some words of wisdom for us to take home and do some homework about. So Margaret, if you're ready to join us, I would love to.
Okay, you ready for the wise words?
Yes, please.
Yeah, okay. I wanted to put this back up as a little bit of context around sort of where we started and the idea of a national conversation. And I'm going to put it down for a minute because I do have notes that I've been putting together, because I also really appreciate the day we've had. And over today, I hear examples of those who see the needs of older people and they respond. This is a tearless story told by Tamara and Mary and most of the other speakers today. There is not a single solution, right? We see many models, but they have common core elements. They're responsive, they're inclusive, they're respectful of the person. I heard the older person determines the services they want and need. They collaborate with many different kinds of community partners, and they're engaging in formal supports. Mohammed and others talked about the potential for growth when all levels of government are sharing in the responsibility for safety. I think this is part of the advocacy work we need to be doing. We see working examples of linking safe spaces for older women and the existing shelter and transitional housing system that exists across Canada. The question about safe spaces for older men who are fleeing violence just kind of hangs out there. A number of the safe spaces today spoke about space for people of all genders, and Dr. Brittany shared findings about what it is to live and age well in Canada and referenced a training that's coming for service providers to be able to access. Among the many interesting points I heard today implicitly, I hear over and over the barrier of social norms. We live in a society that values independence and individualism without recognizing really how we need each other and the truth that we are all going to need help at different points in our lives. It's what makes us human. But these things, contribute to the pervasive shame and stigma at finding yourself in a situation where you need help. Staff being trained to understand the medical prescriptions of older women, understand that a change of living situation can lead them to skipping or not taking the right meds at the right time, and what the symptoms might be. I think this is an interesting, it's sort of specific kind of point that we get out of the work. And one of my favorite points, I think Dr. Brittany made it, policy measures to restrict the purchase of housing as a form of investment, because housing is a human right. I love that. Building rapport with ethnic and religious leaders as part of community outreach. Invite them into your organizations. Seeing an increase in clients who lost everything to scams like grandparent scams. Social workers who do follow-up for a year after leaving a safe space. What a concept. The need to consider the many challenges to living independently as we age. People need support. A reduction in ambulance calls that Mohammed spoke about. What are the real world costs and benefits to communities that are able to provide safe spaces for older people fleeing violence? There are so many social challenges, societal level challenges, like we know what they are. These are the large social forces that create inequities and kind of rain down on individual lives. We have to see that the structural and systemic violence is part of our lives. And then we have to work together to challenge and change systems of exclusion and depression. Carly, Lisa, and Tiffany all spoke about having to turn people away in a crisis, having to transition people to other shelters, people who are not safe for other residents, where do they go? All of these very common situations remind me of the impact of care work, how undervalued and under-resourced it is, and that it is another kind of violence at the system level that is also linked to the idea of women's work. We have to care about the people providing the services, the people on the call today. We need to pay them for the important work that they do. Michelle and Joanne spoke about the importance of community development, grassroots approaches that echoed right through the day, that are responsive to the unique needs of people and also communities. Each community building their own safe spaces with the, sort of what's in the community, tapping into the resources that are there. All day, I see how remarkable it is when caring people organize around the available resources to build and facilitate creative solutions that are funded, but only usually for periods of time. What a waste when there's not a sustained vision for these innovations and groundbreaking work. We need a clear national approach with stable funding. And Dr. Rose reminded us of the importance of trauma-informed approach to empower people, for them to feel in charge, to be in control, and to meet people where they are. It's not what we think they need. Lisa spoke to this, a learning she gained through the experience that the people first at Pat's Place just want to be left alone to recover, to get their feet under them. And people from collectivist communities, they will want help for the whole family, including the person causing the harm. As many differences that we see in the models, the funding, and the mandates, I hear a clarion call that is very clear that creating safe spaces is meaningful, important, and vital work. The panel today was enthusiastic when asked about advice about starting a safe space. If you see the need, just do it. So I hope that you think this is just the start of a national conversation about safe spaces for older people who are fleeing from violence. And I'm going to just go back. I've just got a couple of slides that I wanted to connect this right back to the Future Us, which is a national engagement education strategy, a roadmap to the prevention of abuse of older people. Everyone has a role to play. These are the ideas that we've been talking about. And it was this work that put us in touch with the safe spaces people. Well, relationships are at the center of it all, and helping people to see the role that they play is critical. So recently we've done that with a couple of projects, Seniors Leading Change, a toolkit about starting a network in your community. And this is the gender-based Stop GBV 55+ project, working around stopping gender-based violence for older women and gender diverse people who experience it. This is a call out that I'm going to put out. We're actually at a place right now where we're looking for people to interview. We would like to hear about stories of an amazing service encounter. We hear all the bad stories. Where do we see the places where the service intervention was amazing, changed a person's life? So we'd like to talk to older women, gender diverse people about their experiences, and also service providers. So this is my last little bit today to say, if you, we're send out the flyers, and if you want to participate, if you have your own inspiring story that you'd like to share, we would certainly love to hear from you. So I hope that that kind of connects the dots back to the big picture that the Canadian network and all the community partners are involved in. And that's enough for me.
Thank you so much, Margaret. That was amazing. That did connect all the dots in a very eloquent way. So thank you to all who made it until the very end. Thank you especially to our interpreters who had a lot of work today with all the many good things and good ideas that were mentioned. Much appreciation to all of our fellow peers across the country who, helped this idea and this project be, or this event be born, and who came to speak and who really gave us a really good sense of what's going on around the country. We want to thank our funder as well. We recognize that they were very willing to support this this event, and we're hoping that this will also maybe instill some ideas in them and how they can better support the sector and better support older people who are experiencing violence. And then finally, if you have a thirst for more knowledge, I want to let you know that there are a couple of things happening very soon that you may be interested in. If you see on my screen right now, on the 16th of May this week, Elder Abuse Prevention Ontario is holding a virtual learning series that started yesterday, and it's going on again until the end of the week. It's focused on gender-based violence among older adults, and this session will be on supportive interventions with Dr. Laurie Weeks, who was mentioned actually during our first session this morning with Atira. And then as well, if you are working in any capacity with older adults, or if you are thinking that maybe you should pay attention to what is happening to older adults, we strongly encourage you to mark your calendars. June 15 is World Elder Abuse Awareness Day. This year it falls on the weekend, so on June 12th, we'll be holding a national virtual event. We'll be bringing together a bunch of people who have wonderful, interesting things to say about aging, about about ageism, and how we think about aging in our society and what we can change to make aging better in Canada. So if you're interested, please join us. You can find the registration links on our website, cnpea.ca, as well as eapon.ca. We'll be talking about this more and more. And if you want to get updates, of course, you can sign up for newsletters, and you'll for sure be receiving news anytime they come out about what's coming up. Thank you all so much for being with us today and for, showing up for the adults and for learning. Have a wonderful afternoon and evening, and we will talk to you soon.